Good day, I am Dr. Lourens Coetzee. I'm a refractive surgeon at Sandton Eye Clinic, and with Mother's Day around the corner, I was thinking we should talk a little bit about motherhood and laser vision correction. So I think first off, let's start by debunking a couple of myths regarding motherhood and LASIK. So a common misconception is that LASIK reverses after being pregnant and after delivering your baby, which is absolutely not true. What we do, however, find is that in that 9-month period, you will have fluctuating like refractive or scripts, and you might have like a deviation and find that your glasses are not so perfect, or your LASIK, there's a small change in your refraction rate. You're not seeing as clearly as you used to before you fell pregnant, but that will return back to normal as soon as your hormones stabilize, and when you find that your cycles return and that's normal, and that's when your vision will clear up, or the quality of your vision will be just as good as it was before you fell pregnant. So definitely that is a myth, and therefore you can have LASIK before you start with your family. And the vast majority of patients keep their script stable until they need reading glasses when they are 45. So that brings us to the next question, when can you have LASIK? Or if you plan to have a family, when can you have LASIK? So the big thing is not to have LASIK when you are pregnant. Ideally, we would like it to be 3 to 6 months after you've had your procedure, to fall pregnant if you want to start with a family. And then afterwards, once you've delivered and you want to have LASIK, we want your cycles to return, and then we know that your hormones are all stable. It does differ when you breastfeed. So there's different opinions, and some refractive surgeons will want you to stop breastfeeding before they perform the procedure, but the vast majority feel that as soon as your cycles have returned, you can actually have LASIK. So what you just need to remember is that when you have LASIK, for that 3 to 9 month period after LASIK, you will have dry eyes, and dry eyes is also more common in mothers that breastfeed, and so we just have to look specifically at that and address that dry eye symptoms that you might have. So another question also is, my mother wants to have laser and she's in her 50s. When is it too late to have LASIK? So there's actually no real age, as long as the lens inside the eye and the general health of the eye is good. You can have LASIK. Just in patients older than 45, we prefer to perform a procedure called presby LASIK, where we retain the reading vision as well as improving distance vision. Or if someone needs reading vision, they can see well far, we can actually help them to retain their distance while at the same time giving them reading vision as well without glasses or contact lenses. A good example is my mom. When she had presby LASIK, she was 58, and she is now 64, and she's still not wearing glasses for distance or near, although she's going into that cataract stage of her life, so we might need to do a next procedure for her at some point.